Welcome to my good evening, good morning, good afternoon, depending on where you're coming from. So, if this is your first time of coming across my channel, you are welcome. Please do well to subscribe, like, comment, and share. So, my channel is all about health tips. I'll be sharing health tips. If you are trying to conceive, I'll be sharing how to conceive faster, how to track your ovulation, how to know your menstrual cycle, a whole lot of health tips I'll be teaching you. So please do well to subscribe, like, comment, and share. So today we'll be talking about neonatal convulsion or neonatal seizure. What is neonatal seizure? A neonatal seizure is a seizure that is identifiable by an electrical recording of the brain. Or neonatal seizure or neonatal convulsion are epileptic fits occurring from birth to the end of the neonatal period. The neonatal period is the most vulnerable of all periods of life for developing seizures. So, if you are at your childbearing age, if you are still having children, it's very important to look out for all this. So, let's assume you give birth in a hospital or in a maternity or in a health center, and you want to check if your baby is having neonatal convulsion. Your doctor might not know, your midwife might not notice, but you, the mom, being close to your child, to your baby, you might notice your baby is having convulsion. So, one of the signs of or symptoms of convulsion is when you look at your baby's eye will go up like this. Your baby's eyeballs, your baby two eyeballs will go up like this, like stay for like this for like, let's say 5 to 10 seconds, and your baby is not looking down. What will come to your mind is my baby might be having neonatal convulsion or neonatal seizure. You will call the attention of the doctor or your midwife or the nurses around or your healthcare provider. Another symptom of neonatal convulsion or seizure is twitching of the mouth. Your baby's mouth might be going one side like this. So if you notice something like this, just know that your baby is having neonatal convulsion or neonatal seizure. Then it might come with twitching of the mouth and turning of the eye. So if you notice two of them, maybe like this, something like this, and the eye will be going up like this. You understand? That is the symptom or signs of neonatal convulsion. Another symptom is the hand. Your baby's hand might stretch like this. Your baby's hand might be doing like this continuously for like 5 seconds to 10 seconds, and it will calm down again. Within 2 to 3 minutes, it will happen again. So if you are still in the hospital and you notice this, please call the attention of the midwife or the doctor. Some convulsions might come with twitching of the mouth, turning of the eye, and the arm too. So it might come like this. So if you notice something like this, call the attention of the doctor or the nurse or any health personnel around you. But if you have been discharged from the hospital and you notice this, please don't apply anything on the baby. Don't give anything oral. Just take your baby straight to the hospital. Don't self-medic. Don't treat your baby by yourself. Some people will be like, bring your urine and put in the baby's mouth. Some will be like, pour red oil in your baby's eye. Some people will be like, bring this leaf, squeeze it and put it in your baby's mouth. Your baby is too tender for that. Please don't do it. Just take your baby straight, or you call your doctor immediately. Make sure you clear airways. If you notice something like this, clear airways. Make sure your baby is breathing. Thank you. Those that are joining me, thank you very much. I can see you people. Thank you, thank you, thank you. So, like one of my patients was telling me the other day that her baby died of convulsion and she didn't know. That's why I decided to talk about it today. She didn't know that her baby is having convulsion. It was someone that came to visit them that said, madam, your baby is having silent convulsion, so you don't know? He said, I don't know which one is silent convulsion again. So her baby's own is silent convulsion. Her baby's eye is just going up like this. It will go up, within some minutes the eye will come down. So she didn't notice. She said she thought it was normal for babies, but when that woman came in, the woman noticed. She was familiar with the convulsion, silent convulsion, so she alerted the woman. So, but before they reached hospital, it has eaten deep in the baby's brain. So, though the doctor started treatment, but it was too late. The baby died. So it's very important to look out for your newborn, since they can't talk, they can't express themselves. So we as parents, we have to look out for them. If you are with your baby, if you are carrying your baby, if you give birth new, always observe your baby. So seizures, in the developing seizures, particularly in the first 1 to 2 days of the first week from birth. So it usually happens from the first week after birth. So monitor your baby closely in that moment. There may be short-lived events lasting for a few days only. However, they often signify serious malfunction or any damage to the immune system. Okay, any damage to the mature brain. So, what are the causes of neonatal convulsion? The causes of neonatal convulsion are: 1, brain injury. So that moment that you're having your child, the nurse said, madam, don't push, you'll be like, I'll push. Your doctor or your midwife knows why she said don't push. You understand? Your doctor or your midwife knows why she said don't push. Because if you push that moment, it's going to cause a lot of things. If you push when your cervix is not fully dilated, it can cause brain damage to your baby's brain. It can cause cervical tear. So if your midwife say don't push, you hold yourself, wait for your cervix to dilate fully before you push. So brain injury can cause neonatal convulsion. Number 2, infection. Infection to the brain can cause neonatal convulsion. Infection can cause neonatal convulsion. There are many infections that can cause neonatal convulsion. That's why if you register for antenatal, we will send you to do plenty tests, a lot of tests. Like, we'll ask you to do syphilis, we'll ask you to do RVS, that's HIV, we'll ask you to do hepatitis B, we'll ask you to do hepatitis C, we'll ask you to do blood group and genotype. So in my area, in my part, this part, some mothers, if you send them to go and do tests, they say, nurse, I don't do tests. So I've had 5 children, I didn't do any tests. I'll be like, wow. So if you start having complications tomorrow now, What do you expect us to do? How do you want us to attend to you? If you're having complication, they will be like, God forbid though, I'll not have complication. So that's by the way. Number three causes of neonatal seizure is underlying health conditions such as cerebral palsy. Health condition such as cerebral palsy. Number 4, inherited seizure. Some people do inherit it from their family, from their parents, father family or mother family. So inherited one is not always easy to treat. So these are the causes of neonatal convulsion. So what are the treatments of neonatal convulsion? Though you as a patient, if you are not a medical personnel, you are not meant to treat your baby. Even though you're a medical personnel, you are to ask for a professional help. You have to seek a professional help. Don't self-medicate. Don't treat your baby with herbs. Don't give your baby herbs in the mouth. Don't rub any herbs on the body. Don't put urine in your baby's mouth. Don't go and squeeze some leaves and put in your baby's mouth. Please seek a professional help if your baby is having a neonatal convulsion. Please, someone should like my video. If you are hearing what I'm saying, please like my video, please. I would like to know if you guys are hearing me. Please, someone should just give me a thumbs up, even if it's one. Let me be sure that you guys are hearing me. Thank you. So, treatment of neonatal convulsion is mostly phenobarbital is continued IV, especially if the seizures are frequent or prolonged. When the infant is stable, phenobarbital can be given orally at 3 to 4 mg/kg once per day. Antibiotics like augmentin suspension or ampicillus suspension etc. can be given to the baby. So if you have any question about neonatal convulsion, go ahead and ask me and I'll answer. So like I said before, be observant. If your midwife say don't push, don't push. Some people have what we call cephalopelvic disproportion. So in that case, when you have cephalopelvic disproportion and you are pushing your baby when the midwife said don't push, and your pelvic bone is hitting your baby's brain, or when the midwife is checking you and always putting her hand inside your vagina, always checking you and maybe touching your babies, because when you are in labor, if your cervix dilates up to 7 to 8 cm, 9 cm, 10 cm, and the midwife is always checking your baby and her hand is always touching your baby's head here, if your baby's head is crowned and your midwife is always touching here, it can cause neonatal convulsion too. Pressure to the brain can cause neonatal convulsion. Please, if you are hearing me, someone should give me a thumbs up. If you are hearing me, I want to know if you guys are hearing me. If you are hearing me, please give me a thumbs up. Let me know you are hearing me. Okay. So okay, we'll be going to the next chapter. The next chapter is neonatal jaundice. Newborn jaundice is when a baby's skin and eye turn yellow from too much bilirubin. It is usually resolves as their liver matures and they start feeding, but if it persists, there may be another cause. Yes, so there are minor jaundice. If when you have your baby, you see that the baby's skin is yellow. If you touch your baby's skin like this, it will change to yellow and come back to normal color again. If you touch here, it will change to yellow. If you look at the eyeballs, to be yellow in color or red. So I'll be like, why my baby's eye is red or yellow is because I was bending down too much when I was pregnant. No. Please, if you see something like that, ask your doctor or your midwife the cause of that. And don't conclude it's because you are bending down. So, don't conclude it's because you are bending down. Ask your doctor or your midwife where your baby's eyes are yellow and red. So, in most cases, jaundice, also called hyperbilirubinemia, a newborn will disappear within 2 to 3 weeks. The higher the bilirubin are, the more the baby is at risk of brain damage. So, jaundice can also cause brain damage. It depends on how severe it is. Some babies do have minor. Welcome. Hello, you're welcome. Thank you for joining us. Thank you. Please, if you are hearing me, give me a thumbs up. If you are hearing me, like my video. Let me know that you guys are hearing me, please. If you are hearing me, like, let me know. Because I don't want to make an empty video. Thank you. Sunshine Yummy Treats. Hello. Okay. Thank you very much. Thank you very much. I appreciate those that are joining me now. Thank you very much. You're welcome. You're welcome. Thank you. So, like I was saying, we are talking about neonatal jaundice. So, how will you know if your baby has jaundice? The skin will be yellow, the eyes will be yellow or red in color. But in a serious case, in a severe jaundice, your baby might be having convulsion too or seizure. In that case, your baby will be needing a professional treatment. You will not have to put your baby under the sun for the therapy treatment. You understand? You have to go and seek a professional advice. Don't self-medicate. Don't treat your baby by yourself. Please don't listen to village women. Some be like, oh, it's jaundice, bring a palm kernel oil, put in the eye, put in the nose, put in the anus, put in the mouth so that it will stop. Please don't do that. Take your baby to the hospital if you notice your baby is having jaundice. Some jaundice don't appear immediately after birth. Some do appear 2 to 3 days after birth. So, why I'm telling you this is, if you notice any of this, just know that this might be jaundice. You take your baby to the hospital. Yellowness of the skin, or the eyeball, or redness of the eyeball, or seizure. Jaundice can cause convulsion and seizure, or seizure. Like I've talked about seizure before. If you notice any of this, please don't treat your baby by yourself. I knew a lot of babies that have died from herbal treatment, home treatment. Some their mom will start giving them herbal treatment. Some they will start applying something on the forehead, on the skull. Some they will start giving something in the mouth. Please don't give your child herbal medicine. Take your baby to the hospital. So, causes and types. Causes and types of jaundice. Bilirubin is a yellow pigment produced during the typical breakdown of red blood cells. In older babies and adults, the liver processes bilirubin, passing it through the intestinal tract. However, a newborn is still developing fever. A newborn still developing liver may not be mature enough to to do this. There are two types of newborn jaundice: psychological and pathological. So in any of this, just make sure you don't give herbal medicine. Take your child to the hospital. So what are the treatments of jaundice? There are home treatments for jaundice. That is phototherapy. Understand? So but if your baby's jaundice is severe or serious, that means only phototherapy cannot cure it. You have to see a doctor. Mild jaundice will usually resolve on its own as a baby liver matures. Yes. Frequent feeding at least 8 times a day will help babies pass bilirubin through their bodies. More severe jaundice may require other treatments that uses light to break down bilirubin in the baby's body. In phototherapy, your baby will be placed in a special bed under a blue spectrum light while wearing only diaper and special protective goggle. So if your baby is having minor jaundice, your midwife might ask you to take your baby outside the sun, morning sun. Cover the baby's eye with nose mask. Only your baby will be wearing only diaper. Place your baby in the morning sun. Feed at least 8 times in a day so that your baby's body will be able to pass out the excessive bilirubin in the body system. In every severe cases, an exchange transfusion may be necessary. Transfusing your baby might be necessary. In this procedure, a baby receives small amounts of blood from a donor or blood bank. This replaces the baby's damaged blood with healthy blood. Okay. This also increases the baby's red blood cells count and reduces bilirubin level. So in a more severe case, your baby might be transfused with a donor's blood or blood from the parents, the father or the sibling, so to replace the damaged blood cells. Okay, so that is it. So in our next chapter, we'll be talking about pregnant women. Is it important to register for antenatal? Some people will be like, nurse, when will I register for antenatal? Is it when I'm 3 months? Is it when I'm 6 months or 8 months? My mom don't used to register for antenatal on time when she used to give birth to us. Please, your mommy's time and now is not the same thing. Meanwhile, your mommy's body and your own body is not the same thing. Your mom might not even go to the hospital at all and deliver her baby at home. But remember, your body system and your mom's body system is not the same. Your own body system and my body system is not the same. So some people will be like, I don't take routine drugs, I don't go for antenatal, I don't go for scan, I used to deliver my baby, nothing will happen to me. I used to tell my patient that if you have this baby normal without taking anything, that doesn't mean the next one you will have it the same way you had the first one. Now I'm not wishing anybody bad, but that is how it is. Some people will be like, in my first pregnancy, I did not notice any constipation, I did not notice the vomiting, I did not witness nausea. But in this one, I vomit, I have nausea, I have weakness, fever all the time. I usually tell them that your first pregnancy and this one is not the same. Our body do change. So please, if you get pregnant, that first month is important to start antenatal immediately. It's important to start antenatal immediately. Don't wait for the time you reach 3 months, 6 months, or even some people will not even register at 9 months. When they are in labor, they will come. And where I registered in the village, so I wasn't able to. I came to visit my sister and I went into labor. That's why I came here. You are only doing this to yourself. You are not doing it to us, we the medical personnel. You are doing it to yourself. You are registering for antenatal on time to help yourself. If there are some diseases that are in your system, if you found out on time, you'll be treated and prevented from escalating. So it is important to register on time. Another thing I want to talk about today is going for scan. Some of my patients, if I send them for scan, they will say, "Nurse, I don't have money for scan." Some will be like, "I don't used to go to scan when I was having my other babies." Some will be like, in our lineage, we don't know what is scan. No. In my village, we don't know what is scan. We used to have our baby and nothing will happen to us. Please, going for scan is very important when you are pregnant, at least 2 times or 3 times. It's important. Number one reason why we send you for scan is to know the position of your placenta. It's not necessarily the baby's gender. The position of your placenta how many babies you are carrying. So that is the reason why we send you for scan. So please, so I'm talking about going for scan. If your doctor sends you for scan, don't say, "I'm not going, we don't used to go for scan, I am fine." How will you know how you're inside your womb? How will you know how it is? How will you know how your baby is? How will you know the position of your placenta? How will you know the weight of your baby? How will you know all these things? So it's very important. If you are sent for scan, please go for scan. Thank you. Another thing I'm going to talk about today is testing. Some patients, if you send them to go and do blood grouping and genotypes, especially first-time moms, they will ignore you. They don't know the reason why you're sending them for that. The reason why we are sending you for blood group and genotype, you and your husband, is to know if you are rhesus negative or rhesus positive. It's very important. Rhesus compatibility. So that's why you are sending you for scan. Secondly, to make sure that you and your husband are compatible. Some mothers don't used to go. I don't know. This is a new age. Some people, I'm surprised seeing couples married now without running blood group and genotype test, without knowing their status. Some just go into marriage, no testing, no nothing. It's very important for you to go for test. HIV test, hepatitis B, hepatitis C, syphilis. These 4 tests I mentioned now are very important. Urinalysis test, 5 of them are very important. So blood group and genotype, very important, so that we know how to handle your case. If you are sent for tests, please do those tests because it's for your own good. It's for your own good. Thank you. So at this time, I am very surprised seeing one of my patients came. She registered for antenatal. I asked her, "What is your blood group and genotype?" She said, "I don't know." I asked her, "What about your husband's own?" She said, I don't know. So people didn't do tests before getting married. She said, we didn't do any tests too. So I said, now you must go for blood group and genotype so that we know your blood group and genotype. She went for tests. Lo and behold, she is AS and her husband is also AS. So, but luckily for them, their first baby is AS. After she delivered, we ran some tests, and her baby's blood group is O positive, genotype AS. So they are lucky. So She got pregnant again and came. I was like, so you guys went ahead and started having more babies. Hope you know how risky it is. He said, there's nothing we can do. I cannot leave my husband though. God will help us to. See, there's nothing like God in this one. There's nothing like God in this one. So when she delivered, she went for tests. And the baby is SS. So why are parents putting their children in pain? Because if you see some people going through pains, you understand what I'm talking about. You see that it's not all about love. You have to consider those children. SS kids are going through a lot of pains. So please, if you are not married, or if you are planning to get married, do blood group and genotype to be very sure that you guys are compatible. Don't even do it in one hospital. If you do it in this hospital, try another hospital, then make sure that the results are the same, because some lab scientists do make mistake while doing all those tests. So make sure you go for tests. That's why some churches made it compulsory that before you'll be wedded in their church, you have to go for all these tests. Parents, please stop putting your children in pain. SS children are going through a lot. They are going through a lot of pains. Thank you. So another topic for today is tongue tie. Tongue tie, what do I mean by tongue tie? A lot of people don't know about this. If you deliver your baby, ask the nurse or the doctor to check if your baby's tongue is tied. Because if your baby's tongue is tied and it wasn't cut off when your baby is small or tender, when your baby grows up, your baby will find it difficult to talk on time. Some might not even talk at all. So what is tongue tie? Tongue tie is this rope-like stuff under your tongue. Here, under move his or her tongue. Your baby's tongue cannot come up. Crying, the tongue cannot come up, or your baby is not crying well. Please ask the doctor to check if your baby said it will get resolved. So if you joined me in this live stream, thank you. If you're just joining me now, we talked about neonatal convulsion and neonatal seizure. That was what we talked about in the beginning of this video. I can see those people joining now. Thank you very much. Thank you very much. So we talked about neonatal jaundice, neonatal seizures, silent convulsion in newborn. So I said that if you have your baby in a hospital or in a maternity or in a clinic, look out for seizure or convulsion. If you notice your baby's mouth is twitching to one side, or your baby's eye is going up like this, or going one side and always going one side, your baby's neck is twitching to one side, your baby's hand is stretching like this, that might be a sign of convulsion or seizure. Call the attention of the medical personnel. That is what I said. Call the attention of the medical personnel. If you have gone home, some might not show in the hospital. Some might be when you must have been discharged your baby will start having symptoms of. Thank you very much if you joined me for this lecture session. If you have not subscribed, please subscribe, like, and share. Thank you very much.